Tirzepatide, weight loss, 15 mg per 0.5 ml subcutaneous pen injector is a medication that is used with a doctor-approved exercise, behavior change, and reduced-calorie diet program to help you lose weight. It is used by certain overweight people, such as those who are obese or have weight-related medical problems. Losing weight and keeping it off can lessen the many health risks that come with obesity, including heart disease, diabetes, high blood pressure, and a shorter life. Tirzepatide is similar to a natural hormone in your body, incretin. It works by controlling your appetite. The optimal time to take this medication is as prescribed by your doctor. The daily dosage and use should also be determined by your healthcare provider. Before you start using Tirzepatide, make sure to read the medication guide and instructions for use provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. Check the product visually for particles or discoloration before using. If you see either of these, do not use the liquid. Clean the injection site with rubbing alcohol before injecting each dose and change the injection site each time to lessen injury under the skin. Do not inject in an area that is tender, bruised, red, hard, or has scars or stretch marks. Your doctor will direct you to inject this medication under the skin in the thigh, abdomen, or upper arm, usually once every 7 days. To reduce your risk of side effects, your doctor may have you start at a low dose and gradually increase it. This medication may be used with or without meals. Make sure to use this medication regularly to get the most benefit from it. Remember to use it every 7 days and mark your calendar with a reminder if needed. If you need to change the day of weekly use, make sure the time between 2 doses is at least 3 days, 72 hours. Follow your doctor's recommended medication treatment plan, meal plan, and exercise program. Lastly, make sure to learn how to store and discard medical supplies safely. Some common side effects of Tirzepatide may include swelling/redness/itching at the injection site, tiredness, nausea, vomiting, stomach upset, diarrhea, dizziness, or constipation. Nausea usually lessens as you continue to use Tirzepatide. If any of these effects last or get worse, tell your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. Diarrhea or vomiting may cause dehydration, so it's important to tell your doctor right away if you have any symptoms of dehydration, including unusual dry mouth/thirst or dizziness/lightheadedness. Some serious side effects to watch out for include signs of kidney problems, vision changes, mental/mood changes, signs of low blood sugar, and signs of pancreas or gallbladder disease. It's important to seek medical help right away if you experience any of these symptoms. A serious allergic reaction to this drug is rare, but it's crucial to get medical help right away if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed above. While using Tirzepatide, it's important to be aware of the potential risk of thyroid tumors. This medication has been known to cause a certain type of thyroid tumor in rats, although it's uncertain if the same risk applies to humans. It's crucial to discuss the benefits and risks of using Tirzepatide with your doctor. Avoid using this medication if you have a personal or family history of a certain type of cancer called medullary thyroid carcinoma, or if you have a certain inherited disease known as multiple endocrine neoplasia syndrome type 2, MEN2. If you experience any signs of thyroid tumors such as an unusual growth or lump in the neck, difficulty swallowing, shortness of breath, or lasting hoarseness, it's important to inform your doctor immediately. Before using Tirzepatide, it's important to discuss with your doctor or pharmacist if you have any allergies, as this product may contain inactive ingredients that could cause allergic reactions. It's also important to share your medical history, especially if you have certain eye problems, pancreatitis, gallbladder disease, kidney problems, mental/mood disorders, or stomach/intestinal disorders. If you have diabetes, Tirzepatide may affect your blood sugar, so it's crucial to monitor your blood sugar regularly and discuss the results with your doctor. Be aware of the symptoms of low blood sugar and inform your doctor if you experience them. This medication may cause dizziness, and the use of alcohol or marijuana can intensify this effect, so it's important to avoid activities that require alertness until you can do them safely. It's also important to discuss the use of marijuana or alcohol with your doctor. Before undergoing surgery, be sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Additionally, tirzepatide must not be used during pregnancy, as it may harm an unborn baby. If you become pregnant or suspect that you are pregnant, inform your doctor immediately. Lastly, it is unknown if tirzepatide passes into breast milk, so consult your doctor before breastfeeding. When taking tirzepatide, it's important to be aware of potential drug interactions. This means that it could change how other medications work or increase the risk of serious side effects. It's essential to keep a list of all the products you are using, including prescription, non-prescription drugs, and herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. It's also important not to use tirzepatide with any other product that contains tirzepatide or other medications that are similar to it, such as dulaglutide, liraglutide, or semaglutide. Additionally, tirzepatide may decrease the effectiveness of hormonal birth control pills, especially when you first start treatment and when the dose is increased. This could increase the risk of pregnancy. It's important to discuss with your doctor or pharmacist if you should use reliable backup birth control methods for 4 weeks after starting this medication and for 4 weeks after each increase in dose of tirzepatide. It's also important to inform your doctor if you experience any new spotting or breakthrough bleeding, as these may be signs that your birth control pills are not working effectively. If someone has taken too much tirzepatide and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention. In the US, you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. It's important to act quickly in these situations to ensure the person's safety. It's important not to share this medication with others, as it is prescribed specifically for your individual needs. Your doctor may also request regular lab and medical tests to monitor your kidney function, blood glucose levels, and weight while you are using tirzepatide. Be sure to keep all scheduled medical and lab appointments, and consult your doctor for more details on how to best manage your treatment. If you forget to take a dose, you can take it as soon as you remember if it's within 4 days, 96 hours, after the missed dose. If it's been more than 4 days, 96 hours, then you can skip the missed dose and take your next dose at the regular time. Do not take a double dose to make up for the missed one. It's important to store tirzepatide, weight loss, 15 megagrams per 0.5 milliliter subcutaneous pen injector in the refrigerator in the original container to protect it from light. Do not freeze it. If necessary, you can also store this medication at room temperature, but it must be used or discarded within 21 days. Once this medication has been stored at room temperature, it should not be put back in the refrigerator. Remember to keep all medications away from children and pets. When it comes to getting rid of this medication, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard this product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.